hyperpigmentation or pigmentation irregularities is something that's very common in the South African population. We need to understand what pigmentation irregularities, specifically hyperpigmentation, is. We have cells in the skin called melanocytes that produce a pigment that gives color to hair, our eyes, and our skin. The more pigment we have, the darker the color. Now, there's different causes for pigmentation irregularities. One of the most common causes of hyperpigmentation, dark skin, is sun exposure. One of the other major causes of pigmentation is inflammation. Anything that causes inflammation in the skin. The most common culprit that we see is post-inflammatory hyperpigmentation due to some kind of infection, specifically acne. Burns, irritation of the skin on an ongoing basis like eczema or pruritus, where we scratch and cause damage to the skin, can also lead to hyperpigmentation. It's most common in sun-exposed areas, in other words, in the face, on the hands and arms, neck, and then in the flexure aspects of the body, the areas that move, so the elbows, the inside of the arm, and even the knees. Medication and other medical conditions can also cause hyperpigmentation. Pregnancy and hormonal changes in women is common, and that's referred to as melasma. Now, this is usually confined to the face, but can appear on the stomach and other parts of the body as well. Treatment for this condition will depend on the underlying cause. Is it an inflammatory response? Is it hormonal changes that we are having? Or is it an infection? Certain medications sensitize us to the sun, and that should also be taken into account. When we look at treatment modalities, the most easily available are the topical products. Now, most of these products would contain something like vitamin C, maybe some kojic or azelaic acid, and even hydroquinone, which is a prescription product. Using these products can be beneficial, but they also have some risks, especially if we look at hydroquinone, which can create darkening of the skin if it's overused. Other treatment modalities will include chemical exfoliation like superficial chemical peels, and these also contain kojic acid, salicylic acid, azelaic acid, and even glycolic acid. We have light or energy-based devices, and here we're thinking of our different lasers: intense pulse light or IPL, broadband light BBL works quite well for pigmentation in certain skin types. We have some more invasive treatments like microneedling, dermabrasion, whether it's micro or dermal dermabrasion, and even fractional laser treatment. Your skin type will dictate what treatment would be most beneficial for you. Lighter skin types like a Fitzpatrick 1 to Fitzpatrick 3 respond better to high energy devices, lasers, etc., etc. As pigmentation can be caused by heat and inflammation, specifically in our darker skin types, we have to be very careful when it comes to treating Indian and black skin types. If you want to know more, or if you are battling with pigmentation problems, you can contact us at Dr. Mark Esthetics on 010-824-1393.